Hello, today we are going to be presenting to you our proposal for the use of an obesity assessment tool in the young adult population. My name is Natalie Norton, and I have with me Mariel Martinez, Sarah Poziski, and Kathy Stevens. And so a little bit about each of us. As I said, my name is Natalie. I am currently a trauma ICU nurse. Working in the ICU, I often see what the result of not obtaining primary care can lead to, in particular, what side effects can occur from obesity. I am a strong believer in the primary care and health promotion and catching problems before they can occur. However, health promotion is needed in all levels of care, and working in the ICU, I have the ability to help better my patients' lives through education, compassion, and teaching. The next speaker we have will be Kathy Stevens. Kathy has been a nurse for over 25 years, primarily working in labor and delivery. She is currently the director of women's services at a small community hospital and has held this leadership position for the past 3 years. She also recently became the director of the emergency room as well. She takes responsibility for her own health by making sure that she engages in healthy lifestyle by eating healthy, regular exercise, getting rest, and regular health visits, and maintaining her stress level. Promoting healthy behaviors encompasses her philosophy of promoting health and reducing risk by conjoining individual responsibility and the healthcare community in collaborative effort to achieve optimal health. After Kathy, Mariel will be speaking. And Mariel currently works in a pediatric heme oncology unit as a nurse per diem. She's also in the DMP program. She's doing 2 to 3 clinical rotations a week in a pediatric clinic. She believes in the power of primary care, and even during her rotation, she takes the time to provide anticipatory guidance and education to her patients and their families. She's continually developing skills at assessing, diagnosing, treating, and managing. She has a background in foundational leadership and change theories. She's a firm believer in family-centered care and the impact that a team effort can make. She believes the primary care setting is to provide the education, interventions, and the tools to best promote healthy outcomes and risk reduction. And finally, Sarah will be speaking. She works in an inpatient holding area in the emergency room. She works both as a full-time bedside nurse and as a charge nurse. She's a strong believer in utilizing preventative care in order to promote health. She will diligently do any preventative care she can for herself and educate her patients on this as well to reduce their risk. She believes in the whole person's sense of well-being for herself and her patients. She likes to look at patients beyond their diagnosis to see the whole picture. Social factors, lifestyle, environmental needs, etc. This helps her to promote their health in work situations. Finally, through discharge education policies, she's able to provide all education to reduce health risks and optimize healthy living for all of her patients. As a group, we came together and developed a health promotion definition. Health promotion is helping an individual achieve their optimum level of health. Health promotion and risk reduction is achieved through education, nutrition, physical activity, and routine wellness checks. Health promotion starts with empowering the individual with education and advice from physicians, nurses, nutritionists, physical therapists, and other healthcare professionals. Being proactive in health promotion and working with healthcare professionals, an individual can decrease their risk of disease and illness while promoting a healthy lifestyle and achieving their optimum level of health. This health promotion definition fits with the mission of DRHA, which is to be a regional leader in patient care, education, research, and innovation. For our obesity assessment tool, we were looking at a targeted population of the young adults. The young adults ages 18 through 35. There are many life events that can occur during this time that can alter an individual's ability to maintain optimal health. Things such as college, careers, marriage, and children are some of these many life events that can occur. It has been shown that health habits of young adults develop during their 20s often affect health habits throughout their lifespans. So for this presentation, we want to talk about obesity DRHA recently reviewed records of patients seen in the ambulatory clinic over the past 3 years and discovered these troublesome facts. Number one, 31% of adults who visited were obese. Number two, 15% of children and teenagers ages 16 through 19 were obese, and 34% of those were at risk of being overweight. And number three, 50% of all non-Hispanic Black women patients were obese. Number four, 11 to 21% of patients of Hispanic ethnicity were obese. And number five, obesity was higher in patients who had some college education. The reviewers also discussed that information about types and frequency of physical activities of patients in general was not routinely entered into the patient's medical record. As you can see from the visual on this slide, there are many concerns and complications that can occur from obesity, everything from pulmonary disease to hepatic to cardiovascular problems, in addition to numerous other things. And next we have Kathy, who will be speaking.
Yes, thank you, Natalie, and thank you for joining us. We are quite hopeful that you will find our presentation and our request for you to fund our intervention successful. Like Natalie said, obesity is a growing problem in the United States, and it has been identified that 2/3 of the adults are being diagnosed as overweight or obese. And obesity is considered one's weight being more than what's considered healthy for their height based on a BMI. A lot of adults, especially college-age individuals, they lack nutrition education and the education on high-calorie fast foods because that is a big part of obesity in the young adult population. So in the DHRA, we did review the records from the ambulatory clinic, and it showed that 31% of adults were obese, and that they are also higher in individuals with some college education. 70% of college-age students gain an average of 12 pounds over 4 years at college, and we all know that there's the freshman year can be quite stressful, and that also increases their weight, known as the freshman 15. So for our health promotion intervention using the tool, we wanted to propose an educational approach using the socio-ecological model, which I'll talk about in a minute, but the goal is to bring awareness to the obesity epidemic and the health-related concerns that Natalie pointed out in the beginning with the slide that showed all the health-related concerns, and provide education and tools so that we can decrease the incidence of overweight in our young adults and obese population. DRHRA has always had a vision to be a guiding force for our community and health and well-being, and our intervention aligns with the DHRA strategic plan, which is to support health promotion and risk reduction. The socio-ecological model is a good model to use. Since obesity is considered a significant public health problem in the United States, the socio-ecological model that was created by Yuri Bronfenbrenner is a highly adaptable framework which demonstrates there are yet distinct yet interrelated factors which affect human behavior. The model suggests that levels of influence that affect prevention and reduction programs should address each one of these levels, which include individual, organizational, community, and society, which can be translated into the policies that are created. The model also serves as a reminder that individual knowledge is not sufficient for behavior change. We have to increase knowledge, skills training, and create a supportive environment. All are components in a behavior change model. So our intervention is that we identified participants based on the obesity screening tool that was administered in the Student Health Center, and individuals referred to the program to participate. We chose 25 students for the 12-week course, and the course is going to consist of educational topics with expert speakers who are very motivating and inspirational. We will educate these individuals on nutrition, weight loss, exercise, stress management, motivation, healthy living, and we'll discuss self-care. And to evaluate the intervention, intervention evaluation is very important, so that you can see that your money is well spent and that you are getting the most bang for the buck. All members of this innovative and life-changing program are going to be paired with a healthy living coach, which will actually be a nursing student who will keep in contact with each individual via text or meeting to provide them encouragement. And each member, every week, they will get a $10 gift certificate for the Campus Fresh Cafe donated by the DHRA Nutrition. And at the end of the 26-week course, each participant is going to receive a Fitbit. And we will evaluate bi-weekly pre-test, post-test, evaluating the attendance and completion of the program, total weight loss, and of course, always course evaluation from our participants.
So we will be conducting process evaluations to ensure that we implement this intervention correctly that Kathy had described. The process evaluation will measure whether our interventions were delivered as we intended. The success or even the failure of our project will depend on the correct delivery of our intervention. So we will evaluate the weekly lesson plans for fidelity and the participant attendance for reach and dosage delivery of our intervention. The following outcomes are: the experts will create standardized weekly lesson plans that include current evidence-based practice 1 month prior to the first meeting. The experts will follow lesson plans within the 1 hour time frame at each weekly meeting during the 12-week program, and all participants will have 100% attendance rate during the 12-week program. So our intervention is geared towards the late adolescent and young adult population. Although our goal is to sustain healthier eating and exercise habits, what better way to achieve that for our students than by making it sociable and enjoyable? One way to adapt our intervention to our participants is to consider Erikson's theory of psychosocial development. Altogether, this will be an ongoing time of solidifying their identities, their lifestyles, and applying themselves to build more intimate relationships. So you may remember this when you were in college, but the bottom line was to build friendships and support. So what better way to meet other people than to share dinner plans, have lunch dates, and even start a new hobby in hitting the gym? However, college is also about affordability, about paying for rent, paying for textbooks, paying for food. So these financial restraints are actually common barriers to most people when it comes to establishing healthy diets and exercise, whether in college or not. So we are offering meal stipends of $17 a day for 12 weeks, which totals about $708 per participant to go towards healthier food options. And as Kathy had also mentioned, we will be providing free Fitbit Charge 2 models to all participants who show improvements on their evaluation. So most of us may have heard about Fitbits. They are wristbands that function to track physical activity, but this particular Charge 2 model is a more updated version that offers a variety of features that the other models don't have, including text message alerts, guided breathing sessions, and a 5-hour battery life. However, what stood out to us was its ability to track heart rate and sleep, as we know that cardiovascular function and sleep affect weight gain. Furthermore, studies have shown acceptable accuracy in Fitbits for estimating steps in young adults, as well as efficacy in improving behavior changes for exercise. Our picture here is we would like to offer for not just weight management, but to feel healthier and be healthier. So we will market our participants in ways that are most visible to our population. Paper flyers will be posted. We'll utilize social media, particularly Facebook and Twitter, to post updates and reminders. We'll send electronic flyers through email, through the department listservs. And lastly, we will utilize the power of their campus peers by recruiting members of the student nursing associations to regulate the marketing and recruitment efforts. So to make all of this happen, we would be grateful for the generous grant of $20,000 from the DRHA Advisory Board to bring this intervention to life. We have ensured that no dollar would go to waste. So it will be of no cost for us to have our assessment tool implemented at the U of A student. As you can see here, we can get a room rental for free, and even the gym membership is free to all students. And as Kathy had mentioned before, we will also be getting donations from the DRHA Nutrition Services for meal stipends. Our supplies, mainly paper products, will require minimal costs, as you can see here. And on the next slide, you'll see what our most costly items are. which include healthy snacks for each meeting, financial compensation to our experts, and the overall cost of our incentives for the Fitbits and the meal stipends. So having saved in the rest of our budget, this allows us to provide substantial rewards and incentives to our participants as a form of motivation. So it will require a total of 6 months. The first 2 months will be devoted to planning. We'll acquire our nutrition and exercise experts. We'll develop evidence-based weekly lesson plans. We'll market and recruit our participants. The following 3 months will mark the implementation phase of the 12-week program, and the final month will be used to evaluate our process and outcomes to assess for limitations or barriers.
Hi, I'm Sarah, and I'm going to go over our strategies. So our strategy for sustainability of our health promotion plan is through engagement, contact, and continued follow-up. We project the use of the health screening tool at the UA Health Services to have high success rate and anticipate full implementation of the health promotion plan for all students seeking health services. After the completion of the first program, the College of Nursing and pre-nursing students have generously offered to maintain annual health screenings and health promotion activities at the UA campus and intend to continue contact and follow-up with participants to further evaluate outcomes. With continued maintenance and follow-up, there is a higher likelihood of success of sustainability with implementation of health promotion plans. And that's a quote from Shaw 2013. Finally, with additional funding and success, it is anticipated that we will implement our health promotion plan at multiple college campuses in order to promote the health of young adults on a much larger scale annually. And then we'll go into the DRHA mission and vision statements. So our health promotion plan fits the DRHA mission and vision statements by paving the way of healthy living for young adults through educational and age-specific interactional activities and resources. We have conducted and applied innovative research in order to develop evidence-based interventions for this population and anticipate guiding young adults towards optimal health and well-being. Finally, we propose to the DRHA to join our coalition against obesity by incorporating our screening tool and resources into their care model for young adults. With this partnership, we hope to reach out to all age groups in order to maximize efforts and promote health of all populations in the surrounding area for years to come. The prevalence of obesity among younger adults is estimated to be around 32.3% and leads to obesity-related conditions such as stroke, heart attack, diabetes, cancer, and some other preventable deaths. And that's a quote from Centers for Disease Control and Prevention 2015. Due to alarmingly high statistical rates of obesity, it is imperative that our outreach programs are being implemented to educate and assist our young adult population towards living a healthier life and lowering preventable diseases linked to obesity. Further, medical costs of obese patients are about $1,429 higher than those of normal weight. With the implementation of our health plan, we will not only promote the health of the surrounding community and build positivity, we will lower medical costs and hospitalization rates for the DRHA. Our plan will benefit the DRHA by promoting positive health outcomes for all and educating our young adults to begin a healthy living now. And since obesity is a worldwide epidemic, it is profoundly impacting young adults across America. Our research suggests that this age group requires nutritional education, physical activity, motivation, and environmental changes. With our plan, we will be able to reach out to young adults within the UA College campus and provide them with powerful, life-changing information and resources to better their health and lives. We will engage with young adults and raise awareness of healthy living and obesity prevention through expert education, nutritional support, physical activity routines, and continued follow-up guidance, and a Fitbit completion prize to motivate and further support healthy living long after the program ends. With our plan, we will be able to provide young adults with health promotion resources and make healthy living fun and interactive and make the community a healthier place, one young adult at a time. Health starts where you live, learn, work, and play. And that's a Healthy People 2020 quote. And we hope you enjoyed our obesity prevention and health awareness promotion plan for the young adult population. And thank you for your time.
Thank you.